Welcome back. This is the Dr. Emily Show.
Hi, I'm Dr. Emily Bullock. I am a clinical psychologist by training. I have been an Air Force psychologist in my career, and I currently own a couple of healthcare companies where we provide outpatient mental health services in the state of Utah. And I am on a mission to help people feel more educated and empowered to take accountability in their own lives over their mental health and their physical health and their well-being.
I am here with Dr. Bullock. I am Makayla Hess. I'm on a mission to learn more about mental health because based on my personal experiences and what I know so far, I would love to be a tool within the world of mental health. Okay, so can you kind of explain just a little bit about how you conceptualize a person's mental health and how it relates to their physical health and wellness?
Yes. So the answer I'm going to give today is going to be much different than my answer would have been 10 years ago or 20 years ago or 30 years ago. So I started working in the field of mental health about 24 years ago when I was also an undergrad in psychology. And so everything I've been through in terms of my own healing journey, working with myself, with my own mental health stuff, and studying psychology through my undergrad, master's degree, doctoral degree, and then providing patient care in different types of facilities and with different types of populations. And then also doing my own little research where I get kind of interested in a new idea and then I go off on this huge tangent for a few months, like researching something totally different or related, similar, but like different to what kind of treatment services I'm providing. So after 24 years of doing all of that, I do see things, I guess you could say, in a more integrated and kind of holistic fashion when it comes to people's health and wellness. So most people out there already know that your mental health and your physical health are not separate. Like everything's connected.
Right.
We know a lot more now about the vagus nerve, which is the cranial nerve that connects the brain and the different organs and systems in the body. But we really know now so much more than we even did 15, 20 years ago when I was in grad school about this kind of mind-body connection. And so really when I'm like pondering about this question that you asked, or when I'm doing an assessment with a patient or talking to a friend about their issues or whatever, I'm not just looking at, past history of trauma or what is their history of mental health condition and what's their family history with mental health conditions. Like those are pieces of it, but I'm really interested in knowing a lot more comprehensive information and doing more of a functional integrated assessment to really know so much more about, yes, their history and their family history, medical history.
Which all of it plays a part.
Yes, absolutely. Yeah. And we all have our genetics, but we have genes that can be turned on or that can lay dormant based on our environment and different factors and behaviors and things like that.
Okay.
So it is really interesting to hear people's history of their environment and what it was like for them growing up in childhood, in different stages in adulthood. Also biology, what are the physiological factors like implicated in your body based on how you interact with the environment. So like exercise and food are like the best examples. So an external factor like a food can completely change human physiology based on kind of what you're eating. And then the same thing with exercise. So,
which honestly is not talked a lot about, which is kind of super surprising considering like its weight.
Yes. And of course, there's many hundreds of thousands of people talking about that, like food is medicine and exercise for health.
Right.
But what I've noticed in my career is that there's certain people that'll be kind of experts at their lane, whatever is in their lane. And some people will do a really good job advising a patient or even a friend or whatever about like different alternatives or different factors that could go into like causing or perpetuating like this problem the person's having, but sometimes not. So you might go to the doctor, with and telling them about a certain grouping of symptoms, and they might tell you their conceptualization, their opinion of what they think is going on with you based on all of their experience and training and years of doing whatever it is that they're doing. But maybe food as medicine is actually the food is actually the culprit in what's causing your problem. And maybe that specific clinician doesn't have food on their radar, so they don't even bring it up. So then a person lives their lives for years and decades having no clue that actually the food you put in your body is going to have a direct correlation on a cascade of health factors, mental health, physical health, overall well-being. So yeah, I feel the same way that like there's so many things that people are not talking about, or that the general public is not informed about.
Right.
Certain people are.
Right.
Like when I go on my little deep dives, when I start obsessively researching something, like I might research that and then tell all my friends about it or something like that. Yeah. But like they're like, I've never heard of this ever in my life.
Right.
And yet they have been going to the doctors for years for this like exact problem that could be, they might be able to find a solution through food as medicine or whatever. That's just an example, but
right. And as a doctor, you are like, okay, I want to see your history, all these things that play a part, so we can really reach the core.
Yes. And I think that as clinicians in different areas of medicine and mental health, like one person can't do everything.
Okay.
That's way too big of a burden on clinicians, right? Or even like, no matter what, like, or even health coaches or consultants or whatever, we can't be experts on every single thing.
Right.
I mean, sometimes there are teams of people, like I think about like one of my favorite shows in grad school that I watched was Dr. House. And that's like exactly what they would do is there's this team of experts, someone would come in with a problem and they would try to figure it out comprehensively, like exactly what was causing the problem or exactly what the disease was or whatever and how to treat it. But most of us as clinicians, we choose an area of medicine or healthcare to go into, and then we get specific training in that lane.
Right.
So then our job is to be able to provide the assessment and the treatment within using whatever's within our scope of practice is what it's called. So like that's for, you want to make sure that you're providing the safest treatment to your patient as possible. And it's not safe if it's out of your scope of practice for you to be providing a clinical service on something that you haven't been trained in. Like that's unethical to do that.
Totally.
So we all will choose kind of what we're interested in and go into that area of medicine or mental health or healthcare or whatever. And most of us are not experts on everything. So, which is really good because then people can really become experts on whatever their lane is. But if we're not all educated about all the potential lanes, or all the potential treatment options or all the potential ways we can assess a problem to like figure out what is causing it, if we're not trained on all of that, then we're only able to give the patient an answer based on what our expertise is. So then a patient might have to go to 15 different providers that are all experts in different things to figure out for themselves, like what is really going on here. Like it's a big problem.
Right.
So and that takes a lot of time to do that. It takes a lot of money for people to pay because, at least in the United States, we have this healthcare system where sometimes your insurance will pay for like a second opinion, but your insurance isn't going to pay for you to go to 15 people.
Totally.
Like, let's take depression for an example. So depression is a pretty widespread problem in the United States, right? People, 1 in 4 or 1 in 5 people.
It's probably growing too, right?
Yeah.
Okay.
And so like most, like at 1/5 or 1/4 of the American population at some point could be diagnosed with a mood disorder, like depression related. So it's very widespread. But, okay, people are having this grouping of symptoms that we're calling depression, but actually why? Why are they having the depression? So like you might have someone go to see their primary care doctor, or they might have these symptoms that we're calling depression and go see a mental health provider and get a diagnosis of major depression or any number of the other kind of classifications of a depression type diagnosis. So then their insurance company is going to say, oh, they were diagnosed with major depressive disorder and put on this medication, or we're paying now for them to have therapy services. Okay, that's great. Well, the insurance company is not going to want to go pay for the person to go see 10 other specialists to figure out, like, could the depression actually be caused by something else, like this, or this, or this, or this, or go see a dietitian, or go see...
Which is interesting because depression, you see, is like a symptom of quite literally almost everything in, whether it's like a disease, an illness, a life event, anything.
Right.
And so it's like, why are we like, oh, depression just means go to therapy, or there's one, I mean, it's not really like
one size fits all like, treatment. Yeah. And I think, so when I was growing up in like the 80s and the 90s, there was a lot more of a stigma around seeking mental health treatment than there is now in like 2024. So it's like much better now.
Right.
And I think the COVID pandemic really helped people significantly with that, where people were like, I'm so isolated and alone, like I have to go to therapy. Like, so a lot of people, like even more barriers were broken down during COVID with people finally being willing to like access mental health services. And the stigma around it has gone down even more. So it's great that now people are seeking out treatment for mental health conditions. It's awesome that like physicians and medical providers and prescribers are meeting with these patients and referring them to talk therapy. Like it's all good. Like all good things are happening.
Very positive.
It's very positive. And talk therapy can help a lot of people. Yeah. So I'm not saying there's anything wrong with talk therapy.
Right.
But I guess
compare it with different things to be even more effective.
I guess the problem that I've really been noticing over the last more like 6 or 7 years is there are people that are given this diagnosis of depression, and we're just using that because it's such a good example. And they come to talk therapy and they're working their butts off, like doing, like really following the recommendations their therapists are giving them, but maybe they're not making a whole lot of progress. And then they're thinking like something's wrong with me. Right. And then the medical system is like, well, you just have this treatment resistant type of depression. Like you're just going to have this chronic illness forever. Or, you know, people are telling themselves that maybe, or
which personally, like it was around 3 years ago, almost 4 probably, I was diagnosed with treatment resistant depression.
Yes.
Which is scary. Mm-hmm. It's so scary. You're like, nothing is helping. I was going to different kinds of therapies. I tried CBT. I was trying EMDR for like quite a while. I was like, oh my gosh, I'm working so hard and I don't feel like I'm getting anywhere, which I definitely saw improvements in the way I could cope, which was incredible.
Yes.
But I was like, why am I working so hard and I'm only plateauing? And so, but a little bit later, I tried some medicine. I tried some ketamine treatment as well. A little bit later down the road, I got my hormones tested, and it's like everything I did to move this forward, it's like, oh, I just saw more and more growth. And so it all kind of played along, but it is scary when you're like, oh, I have this treatment resistant depression because I'm trying one thing.
Yeah. And it's hard to know what to do as the person that's struggling with it. It's hard to know what to do.
Yeah, totally.
And then as the treatment providers, I mean, we could do a full on assessment of every single person that presents with these kind of symptoms. We 100% could do that.
Right.
But insurance isn't going to pay for it. Like people don't even know where to go to get comprehensive assessment, you know? But
so that's probably why everyone's like not just getting testing done and everything.
Right. Because a lot of people do have kind of classic depressive symptoms, and then talk therapy works great for them.
Right.
So it would be kind of a waste of everybody's time and their personal funds and everything to get this comprehensive assessment, to then just find out, like, yeah, your depression isn't caused by this, or this. It's kind of classic,
right?
Like depression related to like situational stuff, or the kind of stuff that we do the biopsychosocial assessments on in a lot of the mental health treatment that we do.
Yeah.
But for me, as a patient myself, going through my mental health journey,
Totally.
struggling since I was like 13 years old. So for 30 years of my life, like, I wonder what life could have been like if maybe they would have figured out some of this stuff when I was 15 or even 25, versus me having to do all this research and figure out and try all these different things up until now that I'm 42 years old.
Totally.
You know, or like you're getting a lot of stuff figured out now.
Totally.
You won't have to wait till you're 42 to like figure a lot of this stuff out,
right.
You know?
Which is great that it's becoming more of like more clinicians are implementing it and everything.
Right.
So kind of with like this example that I hear you using a lot with the depression and the symptoms and kind of that unknown, like, so kind of where do you want to go with that? Tell me more about that.
Yes, I actually heard this example last year, maybe on a podcast, and I can't even remember who said it, but they were using this analogy about, you know, a patient goes to the ER because they're having the symptom of chest pain. And so it's like, of course, like we're all very concerned if someone's having chest pain symptoms, because they could be having a heart attack, like they could be having a stroke, like we don't know what's happening. So you have to get checked out. And the whole point of getting checked out in the ER is to figure out, why are you having the chest pain? And sometimes it does actually end up that they've ruled everything out that could be kind of an underlying dangerous medical condition, like a cardiovascular disease or something like that.
Right.
And then they're able to say, like, okay, we're pretty confident that the chest pain you're experiencing is related to anxiety or something. Which is really comforting when we hear that, because it's like, okay, I'm not going to die. Like people, that's very comforting for people to then be able to say like, okay, I'm going to then really try to work on this anxiety issue that I have. Sometimes people are frustrated with that answer because they're like, it's not
very broad.
Like, but it's just a good example to say, yes, people can have chest pain for any number of reasons. But the reason, it's very important to figure out the reason, because then we need to do something about it.
Like chest pain is just the symptom.
Yeah, it's just a symptom. So I really see depression being exactly like that, where we have a group of symptoms like low energy, lack of motivation or decrease in motivation, not really caring to be very social, like being exhausted all the time, and either trouble not sleeping enough or trouble sleeping too much, like appetite changes, either like losing your appetite or having a kind of overeating. So we have all of these symptoms that now we are putting a diagnostic label on as some kind of depressive diagnosis, which again, this is wonderful that we have come so far to be able to decrease the stigma and people are getting checked out and treated and everything like that.
Right.
But the reality is not like, yes, some people do have a depression diagnosis, even when they're like, you know, maybe there's some situational stuff going on in their life that could be causing the depression, or maybe it's a constellation of factors of genetics and upbringing and trauma, and then like current stressors and stuff like that that's causing and perpetuating this depression. Like 100% that totally happens.
Yeah, definitely.
But sometimes there is another factor that actually could be creating this problem of depression and continuing this problem of depression.
Okay.
And it actually could be something that is quite solvable. Because, I mean, a lot of people know why they're depressed, or they know why they're anxious, because it directly relates back to a trauma or lifelong, stress in this situation, or whatever. But a lot of times those things are not like super easy to fix,
Yeah. And when you say solvable, I'm like, that is extremely comforting to hear you say solvable, because with someone like that experiences or past experience, depression and anxiety, it's like, oh my gosh, this feels like such a broad thing, and I don't even know where to begin.
Yeah, and I guess I should be very careful using that word solvable, because that, like, what does that even mean?
Totally.
But I mean, let's say we have a person with the depression that's kind of like how I just explained, where they have like a lot of hard stuff in their lives and like a lot of stress and all of these things that aren't, you can't just like snap your fingers and like it's all fixed, you know, like that's the kind of case where we work really hard in therapy. Yeah, like working really hard in therapy to like process trauma and like gain, you know, figure out like where can you be assertive and like figuring stuff out, kind of using therapy skills.
Totally.
But it can also happen that people can have this constellation of symptoms that we're calling depression that are actually caused by living in like a toxic environment. So mold exposure is a really good example of that.
Okay.
I have a number of people that I know personally in my life, either like coworkers or even personal friends, that they have these like weird vague symptoms, like they're super healthy, but then they have these like depressive symptoms, or they're like chronic fatigue and they're like trying to do everything they can possibly do, and it's like not getting better, until finally someone, either they initiate a test or a clinician initiates a test to find out if they have mold toxicity. And then it ends up they do this mold testing in their house, and their house is just like infested with mold, and they've been living there for 10 years. So like, of course, like
that's like so interesting, because if I would never think to, let's test for toxic environment first. Like that's not, as a average human.
Yeah. And that's not, I mean, even like I was trained as a clinical psychologist. And so in my training, we had to learn how to do comprehensive biopsychosocial assessments on patients. And so we were trying to ask about a lot of different factors in their environment, but I was never trained to ask or to assess about their food intake. Are they eating processed foods? Are they eating foods that have been sprayed with chemicals? Like, I was never trained to ask any of those questions, which actually would factor into the biopsychosocial assessment. Yeah. Okay. I was never trained to ask about or do run tests for, you know, looking for if they have mold toxicity in their body or something like that, you know? And I feel like I got really excellent training in a graduate program that had the 7-year APA accreditation, which is the hardest one to get. So like I went to a very good program.
Right.
But, and then there's clinicians that, you know, go to, you know, physicians that go to four-year medical school, and then they do their residency for 5 years or whatever in psychiatry. And they've never once ever discussed in a clinical setting or an educational setting about like food and how that can impact, or mold. And I mean, these are just the examples we're using today. There's so many other factors that can play into creating symptoms of disease, whether it's chronic mental health conditions or chronic physical health conditions. So, I mean, a huge problem that we have in America is the obesity and overweight epidemic.
Yes.
And so much of that can be directly correlated with the food that we're putting in our body and the lack of movement, creating this kind of metabolic dysregulation within our bodies, where our literal mitochondria of every single cell is not functioning properly and adequately because our bodies aren't healthy.
Okay.
And causing metabolic syndrome. So things like type 2 diabetes, having like being obese or having a lot of adipose like tissue around your waist and things like that.
Your body works in a different way because it's not...
your body's not functioning the way that it is optimized to function.
Okay.
Because of a lot of different factors. And I think people are really aware that sometimes there can be genetic factors. So people say, oh yeah, I have high cholesterol because of my genetics, which like, okay, sometimes people can eat an extremely careful, like whole food diet without any processed foods and foods that are very low inflammatory status, and still have problems with cholesterol. Like, okay, that kind of does make sense that maybe they have the gene or whatever.
Yeah.
But a lot of times our health status of health or disease is highly correlated with our health behaviors and the environments that we have lived in the past and the current environments that we live in terms of kind of the health of our relationships, in terms of the health of the environments we live in, if they're like, if there's mold or if we have like heavy metal toxicity or whatever, like the foods, how much we're moving our body.
There's so many factors.
Like how much stress we have just
That's crazy.
with current events and like the political stuff that goes on and
right.
and just everything. Like we have financial stressors and there's so many hard things.
Yeah.
So many hard things
totally.
in life. So it's very, very complicated for people to really figure out and know, like, why am I having this classification of symptoms that nobody can figure out? And so they're calling it chronic fatigue.
Yeah.
Or like, why am I having all these problems? And after years and years of seeing so many doctors, and then they just diagnose you with an autoimmune disease. But it's like, okay, that's what we're calling it. But like, why do I have the autoimmune disease?
Totally. Which something, first of all, I feel like is super validating is for clinicians to be like, I totally understand that there are so many hard things in life. It's like, let's take a look at all of them.
Yeah.
And in bits and pieces, right? Because everyone studies specific things. But also, like, how do you figure this out? Like, what kind of assessments can you do to really get to it and figure it out?
Yeah. And this is the hard part because I'd love to hear feedback of anybody listening, like if they have a great answer for this, but it's really hard to find one place that can do really comprehensive and holistic testing. What I have found is this is usually just from my personal like research and knowledge and looking at the literature and data, that's been collected in the United States. Like it seems like, when you have a specialist who has medical training in addition to some kind of functional medicine type training and experience to really do more comprehensive testing and analysis to see what is really going on. Because a lot of times doctors or clinicians will order labs. And we can get like basic labs that like your typical primary care physician would order can tell us some really good information. But then there's a lot of missing information that are on that those basic labs are not showing.
So is it difficult to find or to be able to do labs or order labs that do tell the deeper info?
Well, and I'm a clinical psychologist, so I'm not the person that orders all the labs,
Gotcha.
And so, but what I've just experienced as a patient myself is I have had to take initiative to pay out of pocket. So like at I'm a military veteran, so I get all of my healthcare at the VA, and they are allopathic physicians, generally speaking, in the military and in the VA. So they do follow a lot of kind of standard Western medicine protocols. And so that's been very, very helpful for me for a lot of different things that I've dealt with in my medical and mental health history. But then there's also been a lot of like gaps. So me personally, I've paid out of pocket to order specific labs or sought out a functional medicine provider or sought out education and resources myself. And so, but there are clinicians out there that do have practices that are more comprehensive and holistic and do more integrated and functional analysis. So they're looking at everything that traditional kind of Western medicine allopathic providers are looking at, but they're also looking at additional biomarkers that or I shouldn't say most, but that other clinicians are not looking at. And so just like that's such a good example of something that mold lives all over the world. Like mold is all around us. Like it's totally normal. Yeah.
Wow.
Yeah. Mold lives all around us. But when our vitality is high and we're really resilient as an organism, we can like fight off the effects of mold or whatever. But if you're living in a highly toxic mold environment, or if you have a weakened immune system, or let's say for that huge group of people, like 93% of Americans have metabolic dysregulation. So if you're really struggling with your health, and then you also live in a home with a lot of mold exposure, like you're not going to do well, you know? So that's just like a very good example of it.
Okay.
Whereas maybe if you've always lived in new construction homes, and then once the home is like 3 years old, you move to the next new home and like there's never any mold in your environments, then maybe you never get mold exposure to like a significant degree. I don't know. Right. I'm just making that up. But kind of going back to your question from a few minutes ago of like, is there a place we can go or whatever to like get a comprehensive assessment? And it's like, I mean, I think we all ultimately need to be responsible for our own health. Like no one is going to care about your health as much as you do.
That's so true. Yeah.
Nobody.
Our own
like advocate. Not your parents, not your like best friend, not your romantic partner. Like you're going to care the most about yourself.
Yeah.
Like you are your own best advocate. So that's why I love in this day and age, there's so much access to like free information,
right?
And being able, I mean, now we used to have to pay to be able to get a full text article to like look at a research article. Now we can like Google that and get like the full text article. So people can have access now to a lot of information that we didn't have even 20 years ago when I was in training.
Which is awesome.
Yeah.
Yeah.
But for people to try to feel like they know or feel confident to know that there's information out there and that they can empower themselves to go seek the information and become that expert on their own health.
Right.
And there are clinics out there that will do a comprehensive analysis of whatever, you know, like you present with these symptoms and then they're going to do a comprehensive integrative analysis by taking a very comprehensive history. You know, that's what we do as psychologists. A lot of times is do a comprehensive history taking. And then, but also if you're adding in different lab testing, so you can actually look at biomarkers. But if you're testing more than just like a CBC, you're going to get a lot more information. But the problem is, like, should we do that 100% of the time? So like if somebody walks in and they have ABCDEFG symptoms that we're calling depression, do we need to spend $1,000 ordering all these labs? Do we need to spend, you know, all this time going over this comprehensive history taking when maybe that's not necessary and we can do some, you know, a treatment intervention that'll work great? Like, is it worth it to go through all of that other stuff? And the thing is, I don't have to answer that question. I don't. Like, if I'm a clinician or if I own a clinic and I can decide to offer all of that comprehensive testing, but like people have to individually make that decision for themselves, like based on where they're at and how frustrated they are, you know?
And also it's like, no one knows how you feel but you, and no one can feel that but you.
Right. Yeah. But like, for example, I have a 9 and 11-year-old child. So like if someone were to say like, okay, your kid, let's say my kid starts having ABCDEFG symptoms, and then I can choose as a parent, like, okay, I could go through this. I could send them to this specialist and do this testing or like whatever, and then have them do this treatment plan. And maybe it'll work, but maybe it won't. And maybe they'll be 20 and like now it's worse. Now their problem is like way worse. And then they're 40 and their problem is like way worse. Like, I'd be like, forget that. I'll pay any amount of money to like do a comprehensive like deep dive into what could be causing this problem and try to like get my kid help now when they're 9 years old or 11 years old, so they don't have to be in college still struggling, or for a 42-year-old woman like having spent my whole life trying to figure out my health and wellness stuff, you know? Like I would much rather pay more, like pay to get all of this stuff.
It's literally
done,
your well-being. Yeah.
Right. For like my kid. And it is frustrating, but it's just the way that like society works in our country with like healthcare and everything, that like your insurance isn't going to cover everything. Not everybody has insurance. And so sometimes we just have to pay for stuff out of pocket, and it sucks. And sometimes that's a huge, huge burden on families.
Totally.
But you have to like do that risk benefit analysis for your own self or for your own kids or whatever, whoever you're responsible for, to figure out what is going to be best for you. But I think it's helpful to be able to do kind of a deep dive, holistic, very comprehensive integrated and functional like assessment to really look at so many factors, because then you might find
you could like, oh, maybe we could dive a little deeper into this because we found this, rather than they'll narrow it down.
Right. And so, you know, there's people with the autoimmune disease, celiac disease.
Okay.
So there's people that have these worsening symptoms over time where they just feel like crap, and they have all these GI symptoms and their energy goes lower. And sometimes they have, you know, these other like dermatologic symptoms, and they go to all these doctors and everyone's like, oh, take this steroid, or like, oh, do this or do that, or, you know, like kind of band-aids for like the symptoms or whatever.
Yeah.
And like not really ever answering the question of like, why is this happening, or what is this called? It's just kind of like, oh, like maybe you have IBS, and like, oh, you have a rash, like, no, yeah, whatever.
Yeah.
And so like I listen to these stories of these people that are like literally trying to like go to any doctor to like see who can figure this out or who can help them. And then finally they ask for it, or a doctor is like, hey, let's run like the basic like celiac disease like biomarker panel, you know?
Right.
And then they're like, oh my gosh, like maybe you have celiac disease. And then they go into like further testing until they can actually conclude, yes, you have celiac disease. It's an autoimmune condition.
Mm-hmm.
Then they completely eliminate gluten out of their diet, and they're like, oh my gosh, it's like literally a miracle. Like I feel amazing, you know?
Right,
And so it's like, there's some things where, I mean, celiac's a good example because you can literally remove
what's
like
causing
the inflammation. Yeah, you can remove the gluten, and people have very noticeable differences.
Yeah.
So that's kind of a cool example of it, where you can go through the medical system and the mental health system for months or even years or even decades until finally somebody figures it out.
Right.
You know?
Okay.
And I'm not trying to say that like there's always going to be one culprit to like every single problem that we can address and like fix it instantly. Like, no, like I'm not trying to,
it's very complicated, and
like life is complicated. We're very complicated organisms. You know, we're very complicated organisms, and there's hundreds of, sometimes thousands of factors that all go into kind of creating our health status at any given point.
Right.
And so it's very complex. It's not simple, but
yeah. I mean, I guess overall to me, it kind of sounds like you are focused on not treating the symptom as much and really listening and figuring out the patient and kind of getting to the problem.
Yeah. And then in Great Salt Lake Wellness, our therapy clinic. So I started that business 11 years ago when I got out of the Air Force, and I kind of developed my specialty through my Air Force psychology days and then in private practice. So basically what's happened in this 11 years is we've really identified ourselves as Great Salt Lake Wellness as being a clinic that works on helping people address the underlying trauma that perpetuates whatever the symptoms are, or like that. So it doesn't really matter if the symptoms you're having are being labeled, if we have to give a diagnosis, which we do with insurance billing, but like, it doesn't really matter if your constellation of symptoms is being called OCD or PTSD or major depression or, you know, a personality disorder or like whatever it is. Like if there's underlying trauma that needs to be addressed, that is kind of continuing to fuel the fire for these symptoms that we're then putting into diagnostic categories for insurance purposes. Our clinic working on those underlying factors.
Yes.
So that is what I've been doing in my clinical work and in my business over the last 11 years, is really trying to address that underlying trauma.
Right.
So, and then as I learn more, I add more. So even with, you know, I was trained in a couple of my practicum sites during my doctoral training, and then as an Air Force psychologist in my internship program, in my postdoc, and then in the early years of my business, I had been trained, and then I really identified as a cognitive behavioral psychologist. So I was doing pretty strict CBT protocols with all of my patients. And I did find that a lot of the CBT was really effective for people. It was like really helping people in a lot of ways. But then there were a lot of holes, or it would get people, you know, they'd be happy with a certain amount of progress, but there's like still something missing here. Or some people, it doesn't really help them much at all. So then it's like, I'm trying to like figure out, okay, what's missing here? So then a few years down the line in my business, I added more mindfulness-based practices and added clinical yoga to the practice, kind of self-compassion protocols, mindfulness, self-compassion-based protocols, things like that. And so just adding more things. And then it's like, okay, yeah, we can do CBT, or we can maybe even do these other type of trauma modalities, and we can add mindfulness practices. We can add like the movement and clinical yoga and more somatic type treatments. And then about 4 years ago, I started getting super, super interested in researching on psychedelic assisted psychotherapy. So then I'm learning more and more about that. And then I add that to the practice. And so for me, it's been kind of this continual process of not only self-discovery and trying to figure things out for myself, but also then doing the research and talking to many, many people that have been, you know, utilizing certain treatments or protocols, even, getting a lot of treatment for myself before I add something into my own business or something like that.
Right.
But yeah, it just seems like the more years I go by in clinical practice and just as a human being, the more I realize like there's so much that we aren't utilizing in mental health treatment, and so much of it is just mind body connected. And so,
which is probably like super evident for you, being like, let's add this in and see how it affects people. And it probably is only helping as you focus on more and more things that are helpful.
Yeah.
So that's probably super cool to see that growth.
And as a specialty clinic, so we do get a lot of, and Makayla, you do a lot of our intake kind of consultation calls. So Makayla hears a lot about this from people, where we have people that they'll say like, okay, I've been diagnosed with PTSD. I've been, on medications for years, or I've been doing, talk therapy for years. And I did DBT with my provider, and they really think that I could benefit from EMDR or ART. So like at our clinic, we provide a number of different types of trauma modalities. So they'll come to us saying like, I've already come so far, like it's been so helpful, but my therapist brought me as far as they can bring me. And now like they're referring me to you guys for ketamine assisted psychotherapy, or because they're recommending EMDR and you guys do EMDR or something like that. So we, as clinicians in Great Salt Lake Wellness, are hearing a lot of people's stories of like, yeah, I've struggled with this lifelong condition, and I've had this treatment and this treatment and this treatment, and I'm still on my journey of trying to like figure this out, And so it's a cool experience to be on kind of like the clinician treatment end that we're on, but also you and I are both human beings, and we're on our own journeys of trying to like improve our health and wellness. And so
for sure.
So yeah, my goal that's never ending is to be able to provide as much value as I can for people, but to really empower people to get educated themselves, because it would be wonderful. And maybe in 10 years, we'll have clinics all over the place that you can go to one place and they can do brain mapping, and they can do all these biomicro testing, and they can do a comprehensive psychological evaluation of your history and your family history, and figure out much quicker what are the underlying factors here, and then what does the treatment plan need to be.
Yeah, for sure.
Like, I'm sure in 10 years things will be like even more advanced than they are now.
Totally.
But all I can do is what I can do. Yeah. And so adding other additional services for assessment and treatment within the clinics that I own, and being able to get whoever will listen to me to listen to like my ramblings on like what my opinion is, you know?
Totally.
But
in Great Salt Lake Wellness, and also the medical side too, that's hopeful because they're going to grow so much the more we know and learn. And,
right. And so I think it's just really interesting to be able to learn about new testing protocols or tools where we can really look and kind of map the person out be able to inform our recommendations of what we think would be helpful for them, but also to educate them so they are informed, so they can make a decision of like, okay, yeah, I could do X, Y, or Z treatment. I want to start with this and see what happens, because we can't do everything all at once, you know, and there's not an unlimited supply of money that everybody has to like pay for all the assessment and treatment. And so we have to figure out what is going to work best, like in our own individual lives.
Right.
But if we could choose from a variety of options after we've received a comprehensive, like integrated assessment of what's going on, then we can just make a better educated decision for our healthcare.
Totally. Like knowing ourselves is key. Yeah, for sure.
So in this, less than an hour that we've been talking about this, I've tried to explain an overview of kind of how my brain works, on how I try to listen and pay attention as a patient is telling me information, or a friend, or anything like that. But this is just kind of the beginning, I guess you could say, of what we're able to provide, in terms of clinical services and the ideas that I have. And of course, I am not educated on everything, but I like to hear and learn more about these topics and what we could potentially add in terms of a beneficial service for the US population in terms of like getting proper assessment to really figure out what is going on with their physical health, which is synonymous with mental health, you know?
Yeah.
And so
it's improving the overall.
Yeah. And so I'd love to have some more conversations where we go into like a deep dive on certain topics. Like my current area of obsessive research is on metabolic health. And the brain energy theory, and really trying to learn more about that, where it's like, okay, we have 20 years of research on this. Like, why is no one talking about it? Like, this is preposterous. Like, why do we not all know about this? And why is not everyone like talking about it? So there's certain like deep dives that I want to go into in different episodes, and like bringing experts in, because I'm not an expert in all of this stuff. But also just sharing like where I found these resources and what does the literature say, and how to be a more educated consumer in looking at research articles to be able to determine how powerful the study really is, in terms of like, really, can you really glean an opinion off of this based on how well the study was done, and all of that. So
for sure.
So more to come.
Yes. We're so excited to talk about this in future episodes, and
and let us know, for the listeners, let us know which topics you're more interested in hearing about. And certainly we're going to be coming out with more information, more podcasts on a weekly basis. So please make sure to subscribe and check out our future content, and then let us know what you're interested in hearing more about.
Yes, there should be a chat section right below, or you can follow us on Instagram or Facebook at Great Salt Lake Wellness.
And YouTube.
Yes. Okay.
Dr. Emily Bullock. So, okay.
Perfect. Well, we will see you in the next one.
Okay. Until next time.